How to get rid of foot fungus at home. Foot fungus is most commonly known as athlete's foot and can include toenail fungus as well. It can be irritating and painful and often is hard to get rid of. However, there are many over-the-counter treatments and home remedies that can help you get rid of foot fungus at home. Method 1. Using home remedies. 1. Apply a mentholated topical cream. Mentholated topical creams, like Vicks VapoRub, are a good home remedy for foot fungus. These creams contain eucalyptus oil, menthol, and camphor. These active agents all have antifungal actions that help you fight foot fungus. To use this home remedy, apply the cream onto your feet or the affected toenails. Leave it on your feet and do not wipe it off. Repeat twice a day. 2. Use baking soda. Baking soda foot soaks can relieve the itching and burning related to foot fungus. To make a soak, stir 2 to 3 tablespoons of baking soda per quart of warm water in your tub. Soak your feet in the warm water for at least 30 minutes once a day. If you have the time, try using the soak twice a day to improve your results. You can also make a baking soda paste. Use 1 tablespoon of water in 2 tablespoons of baking soda. Stir together to make a paste. Apply it to the nail with a cotton swab and let sit for 10 to 15 minutes. Then rinse with warm water. 3. Try apple cider vinegar. Apple cider vinegar soaks have great antifungal properties. To make the soak, add half a cup of apple cider vinegar to 2 quarts of warm water and stir. Soak your feet for at least 30 minutes once a day, even twice a day if you can manage it. If you do this before the baking soda bath, the combination of the 2 different soaks provides a great antifungal team that will help your feet even more. 4. Use onion paste. In addition to soaks, you can use the juice of an onion to help with your fungus. The juice has antifungal qualities that will help fight your infection. Buy onion juice or paste at the store. Apply it directly to your toes with a cotton ball or swab. Leave it on your toes for 20 to 30 minutes, then rinse off with warm water. Repeat twice a day. You can also use garlic juice or paste, which has similar properties. Method 2. Using essential oils. 1. Buy the right oils. There are a number of herbs that have potent antifungal properties. A great way to apply these is through herb-infused essential oils. Make sure you buy 100% pure essential oils to ensure that you are getting a quality product. There are many different kinds of oils that have antifungal qualities, so you can pick which one you like the best. These include tea tree oil, black walnut oil, neem oil, myrrh oil. 2. Make a salve. After you pick the essential oil you like best, mix equal amounts of the essential oil with either olive oil, grapeseed oil, or aloe vera gel. The oils and the aloe vera gel have additional antifungal properties to help with the fungus. Then, massage the mixture onto the affected foot area or toenails. After you apply it, put on cotton socks and wash your hands very well. Repeat this application twice a day. You can also use an essential oil-infused foot soak. Add 4 to 5 drops of essential oils to 2 quarts of water. Let your feet soak for 15 to 20 minutes. Repeat twice a day. 3. Repeat. Essential oils, like other medicines, are not going to work overnight. Fungal infections of the nails require you to use the essential oil salve for about 6 months. The nails grow slowly, which means you have to treat it until all of the affected nail is gone to ensure the infection does not return. You will know it is working when a clear and normal-looking nail begins to show at the base of the nail. Method 3. Taking care of your feet. 1. Buy the right footwear. To help treat and even prevent further foot fungus, you need to take care of your shoes. Try to wear shoes that are made of breathable fabric. You can also try wearing 100% cotton socks. Other materials don't allow your feet to breathe. Also try buying more open-toed shoes. This helps give your feet room to move around and give them access to open air. 2. Practice shoe maintenance. Avoid wearing the same shoes 2 days in a row. Your shoes need time to air out. Throw away worn-out shoes that might be breeding grounds for bacteria and fungus. Also throw away or disinfect any shoes you wore without socks while you had foot fungus. You don't want to contract the fungus again. You can also spray them with Lysol or other disinfectants to reduce the chance of fungus or bacteria growing in your shoes. If your shoes aren't breathable, try to take your shoes off as often as you can and expose your feet to the air. 3. Keep your feet dry and clean. In order to help your fungus not get worse, keep your feet dry. When you get out of the shower, use a cotton towel to dry your feet carefully. This is especially true if you are in a locker room or public shower. If you have already showered but your feet get wet, wash them separately to ensure they stay clean and dry. Don't forget about the areas between toes. Keeping these dry will help with athlete's foot. Avoid walking barefoot in public areas. Instead, wear flip-flops, sandals, or water shoes. Also make sure you change your socks every day. 4. Wear sandals in public places. Locker rooms, pools, showers, and other similar, moist areas are breeding grounds for fungus. Make sure you never go barefoot in these places. Wear sandals, flip-flops, or shower shoes. Method for understanding foot fungus. 1. Know the risks. Foot fungus is caused by a fungal infection. This infection is common in people whose feet are often damp, warm, and sweaty, or in people who wear tight-fitting or confining shoes. This kind of fungal infection is also spread in public gyms, pools, and showers and can be caught anywhere people walk barefoot. 2. Recognize the symptoms. The symptoms of athlete's foot start between your toes. In this area, a red rash starts to arise. This can spread to cover your entire foot, is often very itchy, and causes dry, scaly skin. It also causes burning sensations on your feet. Athlete's foot can spread to your hands, especially if you scratch the rash. Toenail fungus, another side of foot fungus, causes yellowish or brownish nails that thicken and crumble easily. As time goes on, the nail may separate from the nail bed and come completely off. Toenail fungus is usually not painful, but it can be. 3. Use medication. Athlete's foot can be treated using over-the-counter antifungal products. These come as ointments, lotions, powder, or sprays. Pick which one you think is best for you. Fungal nail infections can be treated by taking over-the-counter antifungal drugs, using an antifungal medication in the form of nail polish, or applying medicated creams. If the infection is more severe, you may need to see your doctor for a prescription for an antifungal medicine to apply to your feet. In severe or painful cases of toenail fungus, the toenail may be surgically removed in order for a healthy, new nail to slowly grow in its place. 4. Seek medical help. If your nail fungus or athlete's foot lasts for more than a few weeks after you start home treatments, see your doctor. There may be something else going on, or the infection may be more severe. If your feet are cracked and bleeding, call your doctor. You should also seek assistance if you notice excessive swelling, itching, fever, or drainage due to athlete's foot. If you have diabetes, see a doctor immediately if you even suspect you are getting either kind of foot fungus. It can be more severe or cause complications if you have diabetes.